Good morning, students. Today we are starting a new system, that is endocrine system, and we are going to learn about thyroid and parathyroid gland. So the thyroid gland, which we are going to learn in this headings, the introduction, location, measurements, various parts, and its relation with blood supply, nerve supply, lymphatic drainage, something about that hormones and the relevant clinical anatomy. So the word thyroid, that means a shield, and it is act as a shield to protect our trachea and esophagus. This is our endocrine gland located between the C5 to T1 vertebra and in front and on the side of the trachea. What are the characteristics? It is the one of the glands which manufactures the hormones, and that hormone is stored within that lumen and it will release only whenever it is required. Also, for hormone formation it requires iodine, so it depends on external environment for raw material. And it is having a richest blood supply, and that is why thyroid surgery is very crucial or critical, and it may lead to severe hemorrhage if bleeding is not controlled. What is the function of thyroid gland? It regulates basal metabolic rate through its hormones. Also, it will stimulate the somatic and psychic growth. In addition, it is having a hormone thyrocalcitonin, which will decreases the blood calcium level. Now, what are the presenting part of thyroid gland? It is having a two lateral lobe, one on either side, and which is connected by an isthmus. And sometimes in the upper border of isthmus there is a triangular projection may be seen, which is known as pyramidal lobe, and that is a remnant of thyroglossal duct. The measurement, if we say the lateral lobe, which is conical in shape with 5 by 3 by 2 centimeter, while isthmus, which is quadrilateral with 1.25 on each aspect, and that isthmus lies in front of second, third and fourth tracheal ring. That demarcation is important, and its weight is around 30 gram, but it may increases during pregnancy. Now, what are the coverings of thyroid gland? They are the two varieties. The true capsule, which is a condensation of fibrous stroma itself, while the false capsule, you can see that green color, that is a pretracheal fascia which is splits to enclose the thyroid gland. And if you trace it above, it is attached to the hyoid bone, and if you trace it below, it is attached to the fibrous pericardium or arch of aorta. And in addition, in the posteriorly, it is attached with the cricoid cartilage, and that thickened band is called ligament of Berry. And due to this, it is attached to the larynx. This thyroid gland is moves with the deglutition. So, જ્યારે આપણે થૂંક ઉતારીએ કે કોળિયો ઉતારીએ ત્યારે thyroid gland up down થાય. If you see the capsule on the posterior aspect, it is thin, and that is why any tumor of thyroid gland may go posteriorly without any swellings. Thyroid no tumor ni swellings આપણને દેખાય પણ નહીં, અને એનું ટ્યુમર થઈ ગયું હોય અને આપણી એની આજુબાજુના સ્ટ્રક્ચર્સ જેમ કે ટ્રેકિયા અને ઇસોફેગસને કમ્પ્રેસ કરી શકે છે. Now, if you see the space between true and false capsule, so between these true and false capsule there lies a parathyroid gland and the trunk of blood vessels, that superior and inferior thyroid artery, which will supplies the gland. Now if we see further, just beneath the true capsule there lies a venous plexus. એટલે એની capsuleની નીચે એની અંદર વેઇનના plexuses છે. And that is why જ્યારે આપણે thyroid remove કરવાની હોય ત્યારે true અને false capsuleની વચ્ચેથી આપણે incision મૂકી અને remove કરવાની, જેથી venous plexus ને injury થાય નહીં. And similar way this will be compared with the prostate. જ્યારે prostate માં false અને true capsule ની વચ્ચે venous plexus હોય, એટલે જ્યારે prostate remove કરવાનું હોય ત્યારે આપણે બંને capsule રાખવી પડે અને true capsule ની deep થી prostate ને remove કરવાનું. Now parts of lateral lobe. It is having an apex, base, three surfaces: anterolateral or superficial surface, medial or deep surface, and posterolateral surface. It is having two border, anterior border, and posterior border. So this is our posterior border. Let us see the relations of lateral lobe. Apex, which is directed upward and laterally, and it is actually sandwiched between the two muscles, sternothyroid and inferior constrictor muscle. In addition, it is also related with the superior thyroid artery and external laryngeal nerve. So these two structures are almost nearer to each other, and as it is approaching the apex ની જેવા નજીક આવશે એ બંને દૂર જતા જશે. Our relation important છે because when we are going to do the surgery we have to ligate the superior thyroid artery, and superior thyroid artery apex ની નજીક ligate કરવાની, જેથી external laryngeal nerve ને injury ના થાય. If we see the base, it is related with loop of inferior thyroid artery and recurrent laryngeal nerve. So again ફરી relation ધ્યાનમાં રાખવાનું, inferior thyroid artery અને recurrent laryngeal nerve પહેલા જુદા છે, છેટા છે, but as it is approaching nearer to the base ની નજીક આવશે ત્યારે બંને ભેગા છે. So inferior thyroid artery should be ligated away from the gland. Surfaces. क्या surface था? Superficial or anterolateral, medial or a deep, and a posterolateral. So anterolaterally it is related with strap muscles, sternothyroid, sternohyoid, superior belly of omohyoid, sternocleidomastoid, and further આગળ skin and superficial fascia. If we see the medial or a deep surface, it is related with the two tubes. Medial માં યાદ રાખવાનું two. So two tubes, trachea and esophagus. Two muscles, two cartilage, two nerves. So two cartilage, that is thyroid cartilage and cricoid cartilage. Two muscles, that is inferior constrictor and cricothyroid muscle. And two nerves, external laryngeal nerve and recurrent laryngeal nerve. Now the posterolateral part. Posterolateral part, it is related with carotid sheath and its content, which having a major artery of head and neck, that is common carotid artery, and major vein, internal jugular vein, and most important nerve, that is vagus nerve. Now the borders, it is having anterior border and posterior border. So anterior border, it is related with the branch of superior thyroid artery, while posterior border, it is related with the anastomosis of superior and inferior thyroid, and the most important one is parathyroid gland. They both superior and inferior are related on the posterior border. And sometimes thoracic duct will be seen on the left side in the posterior pod. Now let us see the relation of isthmus. Anterior surface, it is related with part of sternothyroid, sternohyoid, sternocleidomastoid, and skin and superficial fascia. Omohyoid is not coming away because it is laterally. While if you see the posterior surface, it is lies against second, third, and fourth tracheal rings. Now the border of isthmus, the upper border and lower border. In the upper border, it is related with the anastomosis of superior thyroid artery of each side. And sometimes it shows a triangular projection that is known as pyramidal lobe. And in that pyramidal lobe, sometimes there is a fibromuscular band is attached from the pyramidal lobe to the hyoid bone, and that is known as levator glanduli thyroidi. And remember, આ thyroid gland નો part નથી, પણ આ muscle like tissue છે જે gland ને elevate કરવામાં મદદ કરશે, and that is why એને supply કરશે external laryngeal nerve. Now lower border પછી you can see vein નીકળે છે. So the inferior thyroid vein, which is ultimately drained into left brachiocephalic vein, and આ relation ઘણા important છે when we are doing surgery of thyroid gland. In addition, sometimes the accessory thyroid artery, that is thyroidia ema artery, also attach or rise in relation with the lower border of isthmus. Now the blood supply of thyroid gland, we have already mentioned the two arteries, superior thyroid artery and inferior thyroid artery. We already know the superior thyroid artery and its relation. It's related with the external laryngeal nerve in upper part, and as it is nearer to the gland, it is separated. So superior thyroid artery should be ligated nearer to the gland. And inferior thyroid artery, which is a branch of thyrocervical trunk, and we also know the relation with the recurrent laryngeal nerve. It is away from the recurrent laryngeal nerve, and as nearer to the gland, it is nearer, both are nearer. So it should be ligated away from the gland. In addition, accessory thyroid artery, there may be a thyroidia ema artery, and that thyroidia ema artery is related with the lower border of isthmus. આ સિવાય in that આજુબાજુમાંથી trachea and esophagus, the tracheal artery, esophageal artery will also supply the thyroid gland. Venous drainage, there are three main veins: superior, middle and inferior thyroid vein. Superior and middle thyroid vein will drain into internal jugular vein, while inferior thyroid vein is drained into left brachiocephalic vein. But in addition, sometimes there may be a fourth vein that is known as Koch's vein, and this vein you should be looked after that during thyroid surgery so that it will not lead to alarming hemorrhage. Now the nerve supply it is sympathetic and parasympathetic. Sympathetic, it is from ganglia, and the parasympathetic, it is derived from vagus or recurrent laryngeal nerve, and this will supply the thyroid gland, but the major portion is endocrine control from pituitary. The lymphatic drainage, it is upper part, it is draining to prelaryngeal to upper deep cervical, while lower part it is draining to pretracheal or paratracheal to ultimately lower deep cervical group of lymph node. Sometimes there may be found one prelaryngeal lymph node above the isthmus, and we can take a biopsy of that lymph node to screen out that tumor of thyroid is spread or not. and so that it is known as Delphian's nerve. Now something about the histology, we can say it is surrounded by a capsule that we have already seen, and if we see the histology, it will show us a thyroid follicles which is having a different texture during its activity. If it is in active stage, so more number of secretions will be coming out, so it is having a simple columnar to simple cuboidal epithelium. But sometimes it is in a resting stage, more colloid materials are gathered and which will ultimately compresses the lining epithelium and no more secretory activities, much more, so it is simple squamous to simple cuboidal epithelium. In between the follicles, we may found a parafollicular cells, and that parafollicular cells is important for calcitonin secretions. So which are the hormones? Follicular cells will secrete thyroid hormone, that is T3 and T4, and that will important for increasing the basal metabolic rate and also important for growth and psychic development. While parafollicular cells which will secrete calcitonin, and that will reduces the blood calcium level. And how it will reduce? So calcitonin is released when plasma or blood calcium level is high. Then what happens? It will going to reduce. So how it will reduce? Whatever excess calcium should be deposited into the bone. So bone mineralization. Also the excess calcium should be excreted out from the kidney, and no more any extra absorption from the small intestine. So blood calcium level will ultimately reduces by calcitonin. And remember, this thyroid hormone is controlled by pituitary from which secretes thyroid stimulating hormone, while thyroid hormone itself will negatively feedback and it will inhibit the TSH. Of course, that pituitary is also controlled by hypothalamus, and that will secrete thyroid releasing hormones. Development of thyroid, that is not much important for you, but just remember that the thyroid follicular cells, it is derived from thyroglossal duct, while parafollicular cells, it is derived from neural crest cells. Or some may mention that it is derived from ultimobranchial body or fourth branchial arch. Now the clinical anatomy related with the thyroid gland. Sometimes there may be a isthmus will be get absent, sometimes one of the lobe may be get absent, or sometimes the thyroglossal duct is persist in some part and it will going to form thyroglossal cyst, and that thyroglossal cyst is moves even during protrusion of tongue. And if that cyst is get burst and open onto the skin surface, it will form thyroglossal fistula, and that can also move during protrusion of tongue. And we can pass and know the path of that thyroglossal fistula. Now sometimes the thyroglossal duct will persist only in upper part and no lower down. An extension of it occurs and it will forming lingual thyroid. So thyroid will be seen on the tongue, or it may be seen along its course of thyroglossal duct, and that is known as ectopic thyroid, or it may be seen at an extra sites other than this its normal course, that is accessory thyroid. And absence of thyroid, it is going to causing hypothyroidism, that is known as athyroid cretinism. Now enlargement of the thyroid gland, it is called as goiter, and that may be due to hyperthyroidism or hypothyroidism. In hyperthyroidism, metabolism rate is very much increases, so there is a perspiration, facial blushings, etc., palpitations, etc. And If you observe its eye, it will show a toxic look-like nature and a protrusion of eyeballs, and that is called Graves' ophthalmopathy. And we know that this comedian artist Marty Ardman, that is a comedian artist suffering from that thyrotoxicosis. And the decreased secretions of thyroid will lead to hypothyroidism, and which will having intolerance to cold, decrease receding the hairlines, dry skins, etc. So if hypothyroidism is occur in a children, it is called cretinism, and if it is occurs in an adult, it is called myxedema. So they can see the puffiness on the cheek and etc. Now thyroid tumor can occur, and it may be a nodular tumor too. It may be involving the whole gland, and that may compress the adjacent structure like trachea or esophagus. So we have to remove that enlarged thyroid gland. So there are two varieties, either there is a partial thyroidectomy or a subtotal thyroidectomy. Remember, it is not the total, but it's a subtotal. So we are kept posterior part of or posterior border of thyroid gland intact. Why? Because there is a parathyroid gland lies there, and if we remove accidentally parathyroid gland, it will lead to hypoparathyroidism, which will lead to hypocalcemia, leads to tetany, and patient may die. And that is why we have to preserve the parathyroid gland. And of course, with the thyroid surgery, we have already remember the relation with the artery and nerve. So superior thyroid artery get near to the gland, inferior thyroid artery away from the glands. And we have to remember the cautious vein before putting an incision, so that hemorrhage will be get prevented. And of course, as we have mentioned, preserve parathyroid gland, so that hypoparathyroidism cannot occur. So we know that parathyroid gland is essential. So let us learn that parathyroid gland. So they are in a two pairs on the posterior aspect or posterior border of thyroid gland. So they are superior parathyroid and inferior parathyroid gland. So it's a small oval structure and essential for life, having 6 by 4 by 2 and around 50 milligram in weight. And developmentally, although we can say superior parathyroid, but superior parathyroid is developed from fourth pharyngeal pouch, while inferior parathyroid is from third pharyngeal pouch. Now let us see the first superior parathyroid gland, which is in a constant position that will lies at the middle of posterior border of lateral lobe of thyroid gland and at the level of cricoid cartilage, and it is lies dorsal or posterior to the recurrent laryngeal nerve. While if you see the inferior parathyroid, weight is variable in position. It may lie higher, it may lie lower. So it may lie below the loop of inferior thyroid artery, may lie above the loop of inferior thyroid artery. Usually it is lies beneath the true capsule, but sometimes it may lie within the substance of thyroid gland. And remember, if it is in this position, it is lies ventral to the recurrent laryngeal nerve. Now the blood supply, it is mainly supplied by inferior thyroid artery. Now supply, it is from sympathetic and parasympathetic, mainly from superior and middle cervical ganglia, and its secretory activity is controlled by calcium level. And if calcium level is low, then this parathyroid gland is stimulated, and so that it will increases the calcium level. And if calcium level is high, this parathyroid level is inhibited, and so that blood calcium level is maintain. If you see the structure of parathyroid, it is having a stroma and parenchyma. Stroma will include that capsule, septa and the reticular network, while parenchyma includes that main cells, that is endocrine cells. There are mainly two types of cells, the chief cells or principal cells, and pink color stains, larger cells, that is oxyphil cells. So chief cells or principal cells, they are smaller but more numerous, and they will secrete the parathyroid hormone or a parathormone. And what is the action of parathormone? It will increases the blood calcium level. How it is increases? So in blood there is a less calcium, so we have to increase. So calcium is more in a bone, so it is removes the calcium from the bone, so it is leads to bone resorption. So bone is more fragile. Now it is also doing a calcium reabsorption from the kidney, and so it is prevent excretion, and so more calcium in the blood. And simultaneously it is also increases the absorption of calcium from the intestine, and so blood calcium level will be get increases. While the oxyphil cells, they are larger, less numerous, and that will appear after puberty, and as age advance it is increases, but its function is still unclear. Also, this parathyroid is also infiltrated by adipose tissue or fat as the age is increasing. So parathyroid gland, we know that it is maintaining the blood calcium level, and so if there is hyperparathyroidism, means more parathormone, so more bone resorption, so bone fragility is more liable to be get fractured easily. The more reabsorption of calcium from the kidney, so more chances of stone formations, and more calcium absorption from the small intestine, and high calcium level will having a high neural impulses leads to psychiatric disturbances. So it is a dictum that it is a bones, stones, abdominal groans, and psychic moans in a hyperparathyroidism. While decrease the parathyroid secretions will lead to hypoparathyroidism, and that is a common anomaly seen after thyroid surgery while accidentally removing the parathyroid. And because of that low calcium level, muscles is going into spasm, and that is leads to tetany. And that's all for today.